Deputations and individuals, our break is that's the end of our break. We move on to the second session. Please to take your seat now. We're going to start the second session. Please take your seat. So we are now going to hear the views of deputations and individuals. Ms. Lau Choi Ping from the Kwai Chung Subdivided Units group. Yes, I'm a parent. I want to talk about the needs of carers and the needs of our children. Now, for after-school care program, that is the tutorial service, I hope this will be enhanced because children are able to learn in a safe and familiar environment. And then children, of course, the future of society. In kindergarten and primary schools, we have some 500,000 students, but there are just 3,000 places. So even though I need the service, I cannot really access the service. That means I can't go to work. So I hope for children in need, there'll be more after-school care places for them. And then parents could go to work. That will alleviate our financial pressure. At the same time, it helps to promote the mental wellness of mothers. Now, we are carers. We don't have any income, but then we face a heavy burden. And then there's need for tutorials, help for our children. Now, sorry, I have to leave early. I need to pick up my child. Yes, we get that. Thank you. Next, Ms. Yan Yi. Good morning. First Step Association. Now, we are a non-profit making organization. We have over 1,000 members. They are all on electric wheelchairs. I worked in this federation associate for over 20 years. I think we've been to here many times to talk about support for carers. Now, I think government officials know very well the needs of carers. You know exactly what their plight is. And you have already seen many tragedies because carers don't get enough support. So maybe as you consider short-term measures, well, we talk about regularized and non-regularized support services. That means home care services or residential care services. These are regular services. So for the regular services, will you give proper designated quota for carers? The quota places should not be linked to the persons with disabilities. For example, 6 hours a month. Will give flexibility to carers. If carers need to attend to any emergency, then they could go and attend to their own business using their 6 hours, maybe going to the bank or taking care of the other issues, because carers may have family members as well. And there could also be home physical training, because carers, probably suffer wear and tear to their body because they have to carry the persons they care for and so on. And then now, if carers need to provide any intimate care services, they are the best persons to do it. So, and then other domestic chores can be taken up by someone else. So we could offer such services to them. And then the government should not use the same criteria or use the same waiting list team. You should start a new waiting list, because already insufficient places for PWDs, and if you just take places out of that those services for carers, then it's no good. And then non-regular services, the First Steps Association has been doing that. A few years ago, we started to see that there are younger senior citizens who've just retired, say at 60, and they are still able to contribute to the community. So we've applied for some funds, and we hire a group of retirees aged about 60, and then we give them about $70 per hour. So, and each time they will provide service for 3 hours. So they go to give home support to the wheelchair-bound to live on their own. Now, I won't go into the details about the service, but then what we see as a result is that many people are able to get at least 10 hours of personal service each month. So I hope you will set up such a non-regular service or fund for such service, so NGOs could hire retirees to provide home care to the carers. Thank you. Mr. Yu Ka Kit, the Salvation Army Carer Service. Yes, I'm representing the Salvation Army Carer Service. I'm grateful for this opportunity, so we're able to share with you our views on carers policies. Now, we've seen a number of tragedies involving carers in recent years. It's really sad, and then so we know there's a need to help carers. We need to have timely measures to support carers. Now, this committee set up shows that you have the determination to improve the support for carers. So we'd like to make 3 points. One, for the government subcommittee and carer associations and service providers will have monthly meetings so that we could come up with carer-centric policies that can actually be implemented, and then we could offer real help to carers. Secondly, the government can be the coordinator to promote the continuous support services for carers. Now, it's important that we give due recognition to carers, both by the community and among the carers themselves. And there has to be a carer-friendly community, because then we could improve the quality of life of carers. We could also make sure that the elderly is taken proper care of. This is to achieve the policy of aging in place. And then thirdly, we don't have sufficient capacity to analyze the services we need. The government could work together with universities, NGOs, and carers groups so that there could be thematic studies on carers from time to time. And then we could find suitable solutions. And then in the population census, you could also include information about carers, and then we could formulate a more effective carer-centric policies. Thank you. Thank you. Next, Ms. Song Yue-ling of the Hong Kong Dyslexia Connected.
Good morning. I'm a parent of a SEN child, and I speak on behalf of the Hong Kong Dyslexia Connected. In 1996, Hong Kong implemented the discrimination ordinance, that is Cap 487 of the Hong Kong law, and those with hearing impairments, visual impairments, those with autism spectrum disorder, ADHD, as well as speech impairment and so on, are included in the discrimination ordinance. SEN is a sort of invisible disability, and the general public may not have enough understanding of this disease. And currently, the government is only providing support to carers of elderly persons and of persons with disabilities. And the government is overlooking the needs of carers of SEN children. Carers have to spend a lot of time taking care of SEN children, and these carers are under huge pressure, and there are often tragedies involving these carers. In 2022, in the policy address, the CE mentioned about rolling out support measures for carers, but these measures do not cover carers of SEN children, and our organization hopes that the government can incorporate or include carers of SEN people into its measures. Also, people with SEN should be included in the various types of disabilities under the current ordinance. People often think that people with disabilities are those with visible disabilities, but by judging from a person's appearance, you can't tell whether that person has SEN. And SEN people also suffer from discrimination. In implementing carer-centric policies, carers of SEN people are often neglected. We hope that carers of SEN people can be taken care of, and we hope that SEN can be treated as a type of mental illness. We have 3 recommendations. First, we think that a taxation or tax concessions can be offered to carers of SEN people or SEN children to alleviate the financial burden. SEN children often have to undergo different types of training, including mental counseling as well as speech therapy, etc. And these therapies cost a lot, and ordinary families won't be able to afford these trainings. Secondly, we hope that government can provide transport subsidies to carers of SEN children, and public transport expenditures are high in Hong Kong. While SEN children can apply for relevant allowances, they are not subject to transport subsidies. We hope that SEN children and their family members can get the transport subsidy from government so that their financial burden can be alleviated. Thirdly, we think that there should be medical vouchers given to carers of SEN children. Carers of SEN children have to spend a lot of time every day taking care of SEN children, and they're often exhausted, and they are physically and mentally exhausted. They're under huge pressure. If medical vouchers can be given to carers of SEN children for, say, physiotherapies or other types of treatments, then we'll be able to prevent tragedies from happening. Our organization suggests that applicants eligible for this subsidy can be given a $3,000 subsidy every month. Thank you. Next, we have Ms. Chen Shun Mei. Good morning. I speak on behalf of a family network formed by families of persons in mental recovery. There has been a lack of support for people in mental recovery. Recently, we have some incidents happening in our society, and it involves teenagers and children in these incidents. These incidents form negative perception of persons in mental recovery, causing huge pressure to carers of these people. We lack psychiatrists, psychiatric nurses, social workers, and clinical psychologists working with persons in mental recovery. A psychiatric nurse may have to follow up on 60 persons in mental recovery at the same time. For one case, the psychiatric nurse may only be able to meet for less than 3 times a month with each case. And not every single person in mental recovery is assigned with a psychiatric nurse. Also, we lack clinical psychologists for persons in mental recovery. Members of the family network sought for service support from clinical psychologists, but they have to wait for a year. We hope that more support can be given to family members of persons in mental recovery. First, financial support. Secondly, more public transport subsidy and respite services can be provided. Thirdly, we need, say, 24-hour services or home care services. These type of respite services are needed for carers of persons in mental recovery. Thirdly, the government needs to enact legislation so that carers can be entitled to 12 days of leave, 12 days of paid leave every year. That's carer leave. and this will allow employees to take leave to take care of their family members. So we need carers leave, annual leave, and the so-called buying leave system for carers. And we hope that more flexible work arrangements can be provided to carers. For mental health integrated service centers, we hope that non-Chinese staff members can be assigned to work in these integrated community service centers so that they can provide support to non-Chinese carers or patients, and that these centers can provide respite services or pick-up services to offer support to carers. Thank you. Next, we have Mr. Leung. Chair, here are my views of the carer-centric policies. We are in urgent need of support. Our organization advocates effective policies instead of simple encouragement. We often talk about lack of policies from the government, but oftentimes problems stem from ourselves. Very often people in the society adopt a very positive attitude when they speak about persons with disabilities. This kind of optimism is bothering the disabled people, because these kind of optimism is not helping people with disability. I hope that when we talk about carers, we can avoid being overly positive and instead talk about the actual issues that people face. We talk about the rights and benefits of patients. And so, speaking of this, I am in support of euthanasia. With the economic condition in Hong Kong, I think it's not a right time for us to allow people to opt for euthanasia. We think the government should subsidize people who want to opt for euthanasia to do this overseas. Well, it's not unlawful for us to receive treatment in other countries. Is that right? Well, without care recipients or people who need care, we won't have carers. So with just a change of your perception or attitude, we'll be able to greatly change the way we look at the issues. So I think that the patients should have the right to speak for themselves and make their own decisions. So for care recipients who are very painful, I hope that they can finish or end their lives soon. Thank you. Next, we have Ms. Lee. I'm a social worker working with persons in mental recovery. I want to share some of my experiences working at the front line and the type of needs the care recipients need. I'm glad to see that the government is starting to attach importance to support that carers need. Like other types of services, I think we need to identify as early as possible people's needs. We have government officials sitting here, and we're glad to see them today. However, is carer issues falling under the purview of the Labor and Welfare Bureau only? Well, the Education Bureau and schools also have a part to play. Hospitals as well. We hope that hospitals can identify as early as possible the needs of high-risk carers. This is critical. It's because a lot of carers, they have healthcare and medical needs as well. So when care recipients realize that they need care, they often find it out in hospitals. So if hospitals can help with early identification, that would help a lot. We talked about schools giving out questionnaires to parents. We hope that when carers accompany care recipients to hospitals, and that hospital can ask them to fill out questionnaires as well, that would be helpful. For instance, hospitals can find out whether carers are giving care to more than one person, and this will help us identify high-risk carers as early as possible. So we do need help from hospitals. The organization I work with conducted a survey on people working with carers and care recipients, and the survey summarizes the experience. 30% of the respondents said that caring for carers is not within their expertise, and some respondents also said that in their training they were not taught how to take care of carers. Also, over half of the respondents said that frontline support can be helpful for carers. So we hope that from tertiary institutions we can start emphasizing the needs to take care of carers as well, so that we all know how to care for carers. Thank you. Next, we have Mr. Wong from the Hong Kong Joint Council of Parents of the Mentally Handicapped. Thank you. Our organization submitted our proposal. We've heard the views from various speakers, including social workers. We all understand that carers are facing various difficulties and challenges. They face health issues, life issues, employment issues, and they need a friendly environment to work into. So we need this subcommittee on promoting carer-centric policies to speak for us, but we also need a coordinating committee. So we support the setting up of commission on persons with disabilities, so that we can see policies that benefit carers and persons with disabilities. Apart from coordination effort, we also need a definition for carers. People have come up with different definitions, but currently the government hasn't established a standardized definition for carers. We need a standardized definition so that we know how to execute the planning and assessment work for carers, and we can then think about the obligations and needs of carers. We hope that the government can come up with a standardized definition for carers, so that during the implementation of policies we know whether we fall under the definition of carers. For instance, I may be caring for a child, I may be caring for an elderly person. What kind of benefits do I get under the government's policies? All these are things that we need to think about, so we need a definition. for persons with disability or those with mental disabilities, carers of these people have different needs. And as carers, we have to seek help from different organizations ourselves, and this process is tiring. At different stages of lives of persons with disabilities, there may be different social workers offering help to them. But what we need is a case manager who will continue to follow up on our cases and help us take care of persons with disabilities so that we don't have to run around seeking for help and resources. We think that there is a lack of support for carers. We hope that the government can set up a professional outreach team to take care of the health conditions of care recipients. Also, there has been minimum subsidies for carers. So we want the subsidy amount to be increased. We want medical or healthcare allowance. We also need the $2 concessionary fare when we travel on public transports to help us take care of persons with disabilities. Thank you. Next, we have Ms. Choi Sao-cheng. Thank you, Madam Chair. I attend as an ordinary citizen today. In this meeting, we have just about 11 members of this subcommittee and about 20 members of panel on welfare services and just 5 government officials present today. We have about 50 representatives from various deputations. We also have people on wheelchair who attach importance to this public hearing as they want their voices to be heard. However, we only see just a number of government officials present in the meeting. Going back to the major topic today, we have seen a number of tragedies in Hong Kong recently. On the 25th of May 2023, an elderly person passed away, and on the 14th of May, an 86-year-old father with heart disease passed away with a 59-year-old daughter with Down syndrome. And in another incident, an elderly person with diabetes passed away. On the 11th of December 2022, a 70-year-old couple passed away because they couldn't face the burden of taking care of each other. And also in another incident, an 83-year-old and an 89-year-old elderly person passed away. And in another incident, a 5-year-old SEN child passed away with his 33-year-old mother. On the 7th of March 2022, a son with mental illness passed away with his father due to immense pressure. These are just some examples involving huge pressure of carers. We see a lack of policies to help carers because the government is not attaching enough importance to these lives. The government may have heard all our views today, but what we need is actual follow-up actions from the government. First, we want the government to provide a new definition for carers. We hope that carers of SEN children can be included in the new definition. Secondly, NGOs need support to identify hidden and high-risk carers. Thirdly, we need more emergency respite services. The 24-hour emergency hotline service would not be enough. Fourthly, the government has to think about medium-term and long-term policy to support carers. The 24-hour hotline service is just a short-term support. Lastly, the Social Welfare Department is going to write to those eligible for applying for the subsidy schemes. We hope that the SWD can, instead of just writing to the eligible applicants, can make home visits to the applicants to tell them that they are eligible for applying for cash allowances and etc. Also, we hope that the government can try its best to prevent tragedies from happening again. Thank you. We have 10 members from the Subcommittee on Promoting Carer-centric Policies attending this public hearing today. Just to clarify. Thank you. Morning, Chair. I'm glad to be able to speak here. I have a few points to make on home care services. I see that in the past, hospitals did social worker support or provide social worker support to families in need, and the government has been proactively rolling out one-stop service centers or services to carers and patients so that these people can look for the information they need efficiently. However, we cannot overlook the financial burden of carers and care recipients. A lot of the patients, they used to be the major breadwinners of their families. After they suffer from diseases or various illnesses, apart from their original work, they have to take care of their family as well, and this is giving them a lot of mental burden. We have to help them, otherwise they may get depression or anxiety or different mental illnesses, and they may commit suicide in the end. So we have to confront their mental issues. We need to give mental support to these patients and their family members. The government can think about working with community support centers and care teams in different districts to pay home visits to these people and offer emergency mental services to them. The government can also continue to roll out the Shall We Talk platform and enhance education to the public so that the public can learn more about people with mental illnesses and the relevant policies in place. The government can also offer financial assistance and subsidies to these families and ensure that these subsidies are put into good use. A bed, a wheelchair, and other auxiliary devices or tools can offer great help to persons with disabilities. They need all these support measures in their daily lives. Also, a foreign domestic helper with certain nursery knowledge or care skills can definitely help alleviate the burden of families with persons with disabilities. The government can think about streamlining the application procedures for foreign domestic helpers to come to work in Hong Kong. And while they wait for the application to be approved, and no protection is being given to families hiring for foreign domestic helpers, the government can assess the skills and knowledge of foreign domestic helpers so that families in need can actually hire someone with the knowledge and skills to help alleviate their burden. Apart from at homes, in residential care homes, we are facing a manpower shortage. A lot of times, staff working at residential care homes have to take care of, say, 10 elderly people at the same time. We think that the government can, through the supplementary labor scheme, allow employers to import care workers so that they don't have to go through the 4-week procedure while they hire foreign care workers. It's hard for us to completely understand the issues faced by carers and care recipients. We hope that the government can enhance its publicity and education work so that the general public can have a more understanding for these people. Next, Ms. Leung Ka-man. I'm a mother of a child with ADHD and dyslexia.
I also work as a tutor in a center providing after-school childcare services. And there are 3 ADHD children attending my classes. They may have behavioral issues and learning difficulties. From my experience, parents of these children have unrealistic expectations of their children. Take my son as an example. Starting from primary 1 to now, he is in primary 3. There were only 6 classes on emotional training for him. Students will have to wait in line for a long period of time. My son will be in primary 4 next year, and he still hasn't received any emotional training classes. And we need to understand that medication for ADHD may not be effective, and children are not receiving the support that they need. We can imagine the amount of pressure that their parents face. So there should be more training provided on skills in handling children's emotion, etc. I suggest that there should be more places to train children in after-school childcare services when it comes to their emotional training. It was very difficult for me personally to handle my 3 students in class, let alone handling all other students as well. So my point is, schools should better utilize their campuses to increase the number of classes provided for SEN children after school, so the students will be able to receive the care that they need in a familiar environment, and parents will be able to come pick up their children more easily as well. And there should be more training provided to teachers providing services for SEN children. And I believe that it is essential to have 24-hour services provided in case of emergency. Second, the quality of SEN training. I believe that this requires supervision. My son has received assessment in Children's Health Center, and we waited for the school's arrangement. And so far, he has only received 6 lessons of emotional training per year. I understand that parents with low income may be waiting for the schools to arrange for such lessons for the children. They feel very helpless. So I think that information relating to SEN children should be disseminated to parents more effectively, and subsidies should be increased. I'm sorry, I still have some points to make. For each child diagnosed with ADHD, they should have a caseworker. Understand that many parents of ADHD children have emotional issues. It was very difficult for them to get their children to school, and so they are absent from school a lot, and there are some suspected child abuse cases. I hope that these tragedies can be prevented in the future. Thank you. Next, from the Hong Kong Society for Rehabilitation Community Rehabilitation Network Cornhill Centre, Ms. Chan Chun Yong. Thank you, Chair. Thank you, Madam Chair. I would like to share some of my experience working as a frontline social worker in dealing with child carers. We have provided the subcommittee with a written submission. So we have 3 suggestions to make. First, we believe that an assessment and support mechanism should be formulated. Here, many organizations and carers have mentioned this as well. Currently, we don't have a clear definition of carers. We believe that there needs to be a clear definition. It can be defined by the number of hours of care duties, etc. This can help formulate appropriate policies. And with a carer-centric assessment mechanism, we recommend the establishment of a care manager system, because there are persons or people suffering from different types of disabilities, and there may be differences when it comes to the challenges faced by carers. Carers may face different types of pressure, such as the decision on when to admit the care recipient to the hospital and changes in behavior. These may be factors that cause differences in the stress level. That is why we believe that there should be a categorization of carers. And care managers will be able to provide assistance in a comprehensive way and to provide them with emotional support. And care plans should be formulated for them. This can ensure that follow-up actions are targeted to different individuals. Case managers will be able to follow up on their changes, and this can bring peace of mind to carers. As for the identity or status of carers, we recommend drawing reference from overseas experience. We can issue carers with carer passes to recognize their contribution. So in the daily life, participation from government departments or public organizations, etc., can be engaged. This can show recognitions to the contributions made by carers. That's all from me. Thank you. Next, from the group representing mothers living in subdivided units in Kwai Chung, Ms. Yun On Ching. Thank you. I appreciate this public hearing. We have been waiting for so long during the pandemic. Mothers living in subdivided units have been under enormous pressure. But I'm not a mother myself, and I'm not a carer, so why am I here representing mothers living in subdivided units in Kwai Chung? Actually, on Saturdays, these mothers are very busy. Children have to attend classes, tutorials, etc. So they really would like to attend the meeting here today, but they couldn't make it. That is why I'm representing them here. I'm relaying their views to the Undersecretary and members of LegCo. First, on after-school childcare services. Last Thursday, in a meeting of Commission on Poverty, there was mention of after-school childcare services. This made mothers very happy because childcare services are essential to mothers. This can release women's potential in the labor market. And after they have secured employment, they face less financial pressure. They are living in subdivided units. They don't have space for their children to do their homework on a proper desk. That is why after-school childcare services are very important to them. We can see that there are only a quota of 3,000, but actually there are some 19,000 children in need of after-school childcare services, especially for single mothers. We hope that these services can be expanded to all the students, parents, and schools in need of these services across the territory. This can promote the mental health of parents and children. Children are the future of our society. We want them to have a proper upbringing. Second, on medical allowances for child carers. These mothers may face a lot of diseases or illnesses after giving birth to their children. We hope that they can receive these allowances to help relieve their financial burden so they don't have to choose between having a meal or going to see the doctor. And third, a single mother told me to relate her views here. She is a single mother of 4, some of them with special needs. She is a CSSA recipient. She really didn't have other alternatives. And she works as a freelance worker. This way, her CSSA allowance was cut. Her CSSA was cut in half. I hope that there can be friendlier measures towards single mothers under the CSSA. Allowances should be dispersed regularly to schools across the territories and to review medical allowances to mothers. Here, I relate their views to the administration. If you have heard their views, would you mind giving us a heart with your hands? Thank you. I hope that you have heard their views. I have left my contact method here, so if you want, you can contact us to tell us more about your views. Thank you. Next, Mr. Dicky Chow, researcher of the Our Hong Kong Foundation Limited. Thank you, Madam Chair, members, and other participants here today. I represent Our Hong Kong Foundation Limited. I'm Dicky Chow. Today, I've heard your views and needs. I would like to provide my own views regarding the policies of carers. We have 3 major suggestions. First, on a macro level, well, many speakers have talked about this as well. We would like to see a clear definition of carers. To formulate a specific policy, we have to think about the target of this policy. There are many different types of meaning or definitions when it comes to carer. The CNSD has their own definition, and the Hong Kong Council of Social Services have their own definition. And the scale can vary a lot, starting from 164,000 to 1.3 million carers. There is an 8-time difference between the 2 definitions. This has posed a major challenge when it comes to policy formulation. That is why we want to see a clear definition of carers. We need to come up with an estimated number of carers before the government can formulate appropriate policies. Second, on the provision of services. We want to see services consolidated and that there should be cross-sectoral collaboration. Many organizations here have talked about their needs, so I won't go through them. Perhaps I'll talk about terminal care services. That is not mentioned much here. A survey was conducted on terminal care services. Actually, they covered a lot of different aspects. There are professional guidelines, including advanced medical directives or practical knowledge such as lifting techniques or what types of resources they can get in a community. These are the things that carers are concerned about. There may be financial assistance or flexible working arrangements, etc. In Singapore, in 2018, different types of allowances or schemes were launched. They were to promote flexible working arrangements. 8,000 companies participated, benefiting some 90,000 workers. I hope that the administration can draw reference from these examples to consolidate the services provided. And lastly, on a micro level, I would like to talk about the dissemination of information. We want to facilitate carers' participation. Why am I saying that? This is because in the formulation of policies, are the target recipients getting the information? We need to identify a proper intervention point. Other than acquiring services, recipients are actually partners in the policies. for policies to reach their targets? What types of promotional strategies are effective? We can see that the Social Welfare Department is going to roll out a series of promotional efforts in the coming 3 years. We are happy to see that. We hope that other organizations can draw reference from this strategy. So that's all from me. Thank you. Next, from Hong Kong Association for ADHD, Ms. Marsha Ng. Thank you. Good morning. On behalf of our 1,500 members of ADHD Association, I'm going to give our views. ADHD children have different needs, such as medication and training, so many parents quit their jobs to provide full-time care. However, ADHD patients can only apply for the registration card for persons with disabilities. They could not apply for any tax concessions. So we suggest the provision of an allowance for carers of ADHD patients, and also provide fair concessions and tax concessions. Second, providing emotional support for carers of ADHD patients. We can see that many of these carers suffer from depression and mental illnesses. For district support centers, targeted services cannot be provided to these carers. Currently, there are 5 such district centers implementing a pilot scheme for ADHD patients. We suggest providing carer support services in these centers as well, including temporary respite services, emotional support, etc. These can enhance carers' capability and relieve their pressure. Third, providing cognitive and skill training for ADHD children. Caring for ADHD patients is a very complicated issue. We suggest that the government can set up a qualifications framework regarding the training for ADHD carers. These carers may need to accompany their children to attend training or medical consultation. We suggest that the government can introduce legislation to provide salary or paid leave for these carers so that they can strike a balance between their employment and their family needs. This can also help relieve their stress level. Fifth, providing more support through self-help organizations. Well, we are a self-help organization. We provide volunteer services to provide support for these parents. They can share their experiences and provide emotional support for these parents. With the regularization of the subsidy scheme, there is no need to apply for the scheme again every 2 years. This can also help relieve the burden of these parents, and a network should be established to connect these parents. And personally, I support the establishment of a commission to tackle issues relating to persons with disabilities. Thank you.
Next, a group representing Kwai Chung SDU mothers, Mr. Tam. Mr. Pang. Well, sorry. Today is supposed to be Shui Qing, who's to come here, but then her child has a fever, so she's not able to join us here. Well, that's actually the usual case of mothers' plans may be disrupted because of their children. And so in this case, child has a fever, and then if the mother is a carer, they don't get any subsidy or allowance for carers. So carers may suffer injuries doing housework, or having developing chronic illnesses such as arthritis, elbow pain, and so on. And then some children, some mothers may have dental problems, but they won't go to a dentist because the dental service is expensive. They want to save the money for their children, so they rather suffer the pain and save the money. And then some child carers also say that if they don't have income, then they have earn no respect at home, and nobody cares if they are working doing housework. And as it was mentioned earlier, sometimes mothers become ill, but they dare not ask for money from the husband or the mother-in-law to go and see a doctor. So carers need to also realize that they are making a contribution. And on the question of no income, well, carers may want to take up work, and they know there are respite services, but then probably the location is too remote or the hours are short. For example, respite services will end at 6 p.m. But then the mother may have to take public transport, and then they may not be able to get to the center in time to pick up the children. As I mentioned today, the SU residents not able to come here because the child is suffering from a fever, and so that's why carers' plans are often disrupted because of their children, or they may not be able to find work that suits their hours. So we hope the chairman and members will pay attention to the consider the need for recognition of carers, and also giving healthcare subsidy to carers themselves, and also for respite services, the service hours and the location of such services need to be improved as well. I would like to make some suggestions. Maybe there could be respite care service transport, and there should be lengthening of the service hours as well. Thank you. Next, Mr. Xiu, representing the Kwai Chung SDU Kaifeng Association. Yes, thank you. I represent this association, as you mentioned. Well, when we mention carers, usually we think about women. Very often we won't think about men when there's the mention of carers. So often we won't link carers to men. Now I'd like to speak on behalf of male carers and tell you about their needs and also where improvements could be made to services. First, we want to promote the well-being of male carers. Well, it's not just mothers who take care of children. Fathers are very much involved as well. In fact, many male carers are involved in the caring of their children. For example, bathing them, feeding them, changing diapers and so on, or guiding and teaching their children. But then at the workplace, usually there is no flexibility allowed for male workers who are also child carers. For example, the employment ordinance is the best example. For paternity leave, it's just 5 days. It is not at all comparable with the paternity leave duration in neighboring countries. Now, if we promote support for male carers, and of course men will stand to benefit, but at the same time also encourages sharing of such caring duties, it will take pressure off the women carers. And right now the workplace is not friendly for male carers, so we want to promote emotional support services for men. Now, in the past, women are usually the main carers, and so the men's role is not recognized. Actually, men need to be successful at work. Of course, they need to make a living to support a family, but then at home, they also need to take care of their wife and children. So if men carers have to take care of their work at the workplace and also take care of family members at home, they also have various needs. They are also under stress. And so they have to cope with the stress at work, and because now there are no friendly measures for men carers, so they feel that no one cares about them. So eventually, men may become reluctant to share the responsibility of taking care of the children of their spouses, and that's not what we want to see. So we want the government to recognize the needs of men carers, and there will be policies to support men carers. Only then can we give more recognition and accommodation to men carers. Thank you. Last, a concerned group on the grassroots carers' rights for Yao Qimong. Yes, I'm Mac Wing Yan. Yes, the Undersecretary said this morning, or explained to us the government's policies, and then this morning someone else mentioned child carers. So I'm going to speak on child carers, and I hope the government officials and members will pay attention to this issue. First, I'd like to make a point. For single-parent child carers, they focus on the family. They have to take care of family matters all through the year. They don't receive any support. At the same time, they have to take care of the financial burden. And as some members said, even if they are seriously ill, they have to take care of the family. And they have to take all the stress on their own. And there's some serious emotional stress as well. The Hong Kong CSS conducted a study on breathing space for carers. There should be services to give breathing space to carers. This is important to relieve the stress of carers this way. And so carers then will have some free time to attend to their personal business. They could go for a medical checkup, or they can even engage in social activities, and then they could build a support network on their own. Now, perhaps people may think that for parents who both work, or for CSSA households, maybe for CSSA households, the mothers don't have to work, so they can spend more time on caring for their family. But then from the experience of all our residents, the experience is not the case. They may seem to have a lot of free time, but then whatever free time they have is still spent on attending to household chores or guiding their children. Especially for carers of SEN, they are under even greater pressure. So do they also need breathing space? On child care services, the demand far exceeds the supply. There are few quota places. In any case, the quota places are just for working family. As for CSSA singleton household, there is no such support. So they are under stress, and they don't have no more hope for the future, and so life is really tough for them. And then if they then snap, then you see tragedies. Now we know that we're seeing more and more tragedies involving carers, and when you hear about such a tragedy, what do you think? I'm sure you agree one tragedy is one too many. And then if you consider the policy address and budget, there is still not enough support for singleton carers. And perhaps they are an overlooked group in terms of allocation of resources. So shouldn't the government pay attention to the needs of singleton carers, and then you could take concrete action to address the core issues? Thank you. So 51 deputations and individuals spoke. Now, I'd like to invite Mr. Ho Kai-ming, Undersecretary for Labour and Welfare, to give a brief response. Thank you. Thank you, Madam Chair, and thank you all for coming here to give us your views. Well, in fact, we've met with different representatives. Your views are similar to theirs. For carers, of course, they may not have received any training. They don't just become carers after training because all of a sudden a family member needs care and then you become a carer. And for people who become carers, they probably are not prepared for that and they don't have any advanced training. But then most people don't know how to access information on training. And that's why in the Bureau we are saying that actually the resources available. The question is whether people know about these resources, and then also these resources are rather targeted. Because when carers may, there are various issues, disabilities, financial burden, and so on. So that's why what we try to do is to first improve the matching, so carers know what services or resources available, and because they are the ones who know best what their needs are. Of course, there could be a case management system followed up by social workers, but of course, no one will know about all available services. Apart from the SWD, there are many other groups providing services to help carers. And no one can tell you what services are the best for you. Only you know yourself. That's why it's important that the information is made available to carers so they know what to choose. Maybe sometimes they want to spend more time on carers, and sometimes, and then at other time they may want to go back to the job market. So that's why we are trying to improve matching. And that will also help to improve our overall carer policies. That's a brief response. Thank you. Members, you can now press the request to speak button and indicate your wish to speak. Each member will have 4 minutes for questions and answers. First, Dr. Tik Chi Yuen. Thank you, Madam Chair. This is good occasion. In this public hearing, we are able to hear the demands of carers. That shows too that we're not doing enough. That we need to improve the quality of life of carers. We also talk about protecting lives. So can I make a specific suggestion? Now, for all these oral and written submissions, can the Secretary turn them into a list of demands, and then we could go through the list one by one with the government, and then in future when we prepare our report, then we can follow the list to see where we succeed in striving for such services and where we have failed and so on. As for the submissions made today, I have 4 points for the Undersecretary. Do you have any specific response? These are the 4 points that are more frequently mentioned just now. First, definition of carers. Many groups have expressed their views clearly. Now, for carers, can you expand the scope to cover SEN children and single parents? So are they included now? Secondly, we have a 24-hour hotline, but we have 24-hour information, but we don't have 24-hour support. Some mention community support centers. There are 2 such support centers on trial. So do you have plans to provide community support centers to provide support services in all districts? Third point. In 2022, the government commissioned the university to do a consultancy study on the needs of carers. Do you have any plans as to when the recommendations will be implemented? And last point is, many have asked for a commission on persons with disabilities. So what is the government's position? Undersecretary. About 24-hour support. As I mentioned in the opening remarks, we're going to set up a 24-hour hotline. And if you want that to be district-based, I think it's not possible for us to deploy resources in such a manner for the whole territory, but rather we are going to man a 24-hour designated hotline, and then there could be referral to the nearest facilities. We also provide a transport allowance so people could reach that center for receiving service. So we believe that is good arrangement. The hotline will be set up in the third quarter of this year. We are now inviting tenders for providing the service. Second point, definition. As we said, as the first step, we will just cover carers for elderly and for persons with disabilities because the needs are better defined. Of course, today we hear mention of SEN, ADHD, and other groups of carers. Yes, we know carers are under stress too, taking care of different persons with various issues, but then we want to start first with the two groups. And we will see if how much resources we have in future after providing services for two groups, and then we expand the scope depending on the situation. What about the Commission on Persons with Disabilities? What is the government's position on that? And what about the consultancy study and the plan? What is the progress?
We have representatives of persons with disabilities in our commission. Now, when demands are raised, we have to handle them. We have representatives of persons with disabilities in the Rehabilitation Advisory Committee. We also have social workers sitting in the committee. And we talk about proposals in our committee. According to the classification of the UN, there are 10 types of disabilities, so the scope that we're talking about is quite wide. If we only talk about demands and needs and without coming up with solutions, that's not the best way to deal with it either. So we will look into this after the meeting. How about the proposal in relation to the 2020 consultancy study done by the Polytechnic University? We have studied the report. We will report our progress in due course to the panel on welfare services. And the policy address will also roll out the latest updates. Next, Mr. Bill Tang. I thank all the speakers for attending the public hearing today. Some of them even brought their children. So I thank them for being here. I've been the chairperson of the Panel on Welfare Services of the Legislative Council. In our regular meeting on the 10th of July, we will also talk about support for single-parent families. I hope that the government, after listening to the views of the single parents here, they can make a response on in the meeting on the 10th of July. I hope that we can take an organized approach and sort out the matters that we have to deal with at the LegCo. So this subcommittee has a great responsibility. We are facing an aging population, and we should attach more importance to the support we give to carers. I suggest that the government have specific discussions on each group of carers. Well, Mr. Dick also mentioned about coming up with a list of work we have to do, so I hope the government can consider that. I believe people who were present at the meeting today have read the government's paper. There were some recommendations from the report of the consultancy study done by the Polytechnic University. I understand that the government is taking a prudent approach in spending public funds. It may not be easy to ask the government to devote more resources or to increase subsidies for carers. Well, the government made 2 recommendations. One of them is to set up a one-stop information gateway. Well, we have talked to families with elderly people suffering from dementia. It's not easy for these elderly people or carers of these elderly people to browse the internet and look for all the information. Well, the government in its paper said that it has commissioned the Shuyuan University to develop the website. Let's assume that it is a comprehensive website. Well, does the government have a KPI to ensure that carers are aware of this information gateway and that every carer has this mobile app installed on their mobile devices? Can the government send officers to work with, say, social workers or people working in the hospital and, say, spend 5 minutes to them to explain to them about this mobile app? Can you set a KPI to ensure that people are aware of this mobile app and that there can be an interactive function provided by this app? This is my first question. Secondly, about the designated carer hotline. Can the government share with us how you will operate this hotline? You say in your paper that you will provide instant consultation and counseling, outreaching, emergency support and referral services, etc. And it is a 24-hour carer hotline. Say a carer feels exhausted and he wants to talk to someone and he wants to see if respite services can be provided so that he can take a break for a while. If you receive a phone call from a carer like this, how are you going to deal with it? Under Secretary, on the operation of the carer hotline, I'll defer to my colleague. I don't think any carers will think that they are the only ones responsible for caring their family members. As mentioned, carers often become carers unexpectedly. We will provide referral services so that carers can take a break and that their neighbors can also offer help to look after the care recipients, or even the neighbors can also help look for services they need. On the operation of the carer hotline, Deputy Director, please. We will have social workers manning the carer hotline to provide instant counseling. Also, we will provide information to people who use the hotline services. We'll also provide one-stop services to refer them to, say, daytime or nighttime services they need. We understand that carers have to seek help themselves in relation to looking for respite services, so that we hope that our hotline can provide one-stop services to carers. We have respite services available, and we have a lot of service places available. Say for daycare elderly services, our utilization rate is about 50%. So through providing information and the one-stop services provided by social workers manning the hotline, we can better utilize the resources available, and we can provide actual support to carers. Before the next member speaks, I'd like to know if any members would like to speak for the second round on this topic. I'll first invite all members to speak, then I'll ask the deputations to speak. Mr. Gary Zhang. Madam Chair, I appreciate that there is this opportunity for all the speakers to voice their opinions. There are parents who brought their children here. We were concerned whether the children would feel comfortable here, but one of the social workers said as long as there is a good arrangement in place, children can feel comfortable in this environment. I'm not sure if I get one of the comments clearly. For Ms. Choi from the child care groups, she said that there are difficulties faced by carers. So I want to know about the actual difficulties you're facing when you apply for subsidies. And Ms. Lai, that is deputations number 22. I don't think I got her views clearly, so I want to hear from her again about family care. I want to echo Dr. Take's views that we should come up with a list on all the views that we have heard. I want to know if the demands raised by the deputations here are currently covered by the policies for carers. If not, why, and what information or resources can be provided to them. If there is insufficient resources dedicated to them, again, why, and whether we're going to allocate more resources to them. Well, we have just set up this subcommittee, and in the future, we are going to focus on finding out the root causes of all the problems. For instance, we talked about SEN children and their needs. I think our subcommittee can serve as a platform to set priorities. For instance, why are SEN children at a lower priority? Is it because we do not have public funds? We do not have enough money? So the subcommittee has to discuss all these issues. Those are my questions for deputations. Should I ask Undersecretary to make a response first? I believe that's not necessary. Well, each representative can only speak once at public hearings. Well, I believe we can ask them questions if we want to. All right. Ms. Choi, can you give a response, please? Thank you. There are no specific subsidies or allowances provided to child carers. Some child carers may apply for textbook allowances. Or working family allowances. Textbook allowances are specifically for children. As mentioned, carers with no income, they do not get the respect they need in their families. During their leisure time, if they want to do something on their own, they do not have money to do so. And when they have certain health conditions, they do not have enough money to receive treatment either. If the government can roll out a subsidy scheme for carers and establish or confirm their identity as child carers, that would offer a lot of help to them as they're in desperate need for this subsidy. Undersecretary, I think some speakers mentioned about the amount of $405. This is for single parent families, we give them an additional $405 under the CSSA scheme. Apart from the standard subsidy they receive, they get an additional $405. I have a follow-up question. So regardless of how many children they have, they'll just get an additional $405? Yes, but per head count, the amount will be raised in accordance with the number of people in the family. Mr. Michael Luke, I'm glad that we have some 50 speakers attending this public hearing and sharing with us their valuable experiences. I've heard some creative ideas from them. They've talked about the financial support and service support they need. I have my own views as well. For your consideration, on training for carers, I've been promoting family education policy in Hong Kong. For parents of SEN children or parents of children with disabilities, they often feel helpless. They don't know how to handle their children, and they do not know what kind of support is available. The professional support we get is far from adequate. So at the end of the day, we only rely on parents to take care of their children with special needs. In order for the resources devoted to be used in a more effective way, we have to think about how we can enhance the capability or capacity of carers instead of just allocating money. For SEN children, some people are of the view that money allocated to schools can perhaps be spared for helping SEN children. Well, I have a question for Undersecretary. You have years of experience working in the district level. In the government's paper, there is mention about the role of care teams. As mentioned, we never have enough professional support from healthcare or medical personnel. So professional support is one thing that we need. How about care teams? I understand that the government is building a platform bringing together volunteers to serve on the care teams. I understand that within 2 years' time, care teams are getting about 800,000 to $1 million. But the resources we need may not be limited to monetary terms. We need technical support as well to help enhance the skills and capability of carers. Any ideas, Under Secretary? Thank you. We want care teams to help disseminate information. 2 weeks ago, SWD colleagues went to the district. There are different district services available, and people in the district may be familiar with them already. But for professional or dedicated services for, say, people with disabilities, they're only available in a few districts in Hong Kong, and not everyone is aware of these services. And people not from those districts may not know how they can get the resources and services they want. So we're thinking that we may need the help of care teams to help disseminate the information and provide the support to carers so that they can obtain the right kind of support they need. Just one more point, Madam Chair. I hope that in the future, care teams can enhance communication with NGOs, say elderly centers, etc. In the past, we weren't able to obtain information from of service users, and such information cannot be passed on to the organizations concerned. So I hope care teams can be the point of connection, or can help enhance the connection in this regard. Thank you.
It is my turn. Members who wish to speak for the second round, please note that you will have 2 minutes, including question and answer. Today there are 52 deputations and individuals here with us. I would like to express my gratitude to you. I understand that some of you live in the new territories and it may not be easy for you to come here today, so I thank you all. I have a few points that I would like the administration to respond to. As Mr. Gary Zhang said, currently the definition of carers is unclear. Very often focus is put on carers for the elderly and carer of persons with disabilities. But today there are many child carers and carers of children with special needs and rehabilitated people. So does the administration have a blueprint or timetable to set the definition of carers so that appropriate policies can be tailor-made for these different carers? Second, on carer database, drawing reference from other countries such as Singapore. They have a comprehensive database on carers. Hong Kong is a few steps ahead when it comes to social welfare, and how come we do not have such a database? With the establishment of such a database, various policies targeting different types of carers can be formulated both in long, medium, and short term. And then on the 24-hour hotline, the hotline will be designed by the Xuan University using the lotteries fund. From my experience, in the past, For 24-hour hotlines, there were 5 social workers who were on call. The demand for such services is quite high. So will the hotline be manned 24/7? In the middle of the night, there may be some emergency cases. Will there be proper intervention when it comes to these emergencies? Under Secretary. Madam Chair, regarding your third question, our hotline is or will be operated 24 hours a day. So people can call in the middle of the night. As for referral services, there may not be that many places available in the middle of the night, but we will endeavor to meet the needs of users. How about crisis intervention? Are you sure that you can support that? Well, we do have outreach teams. We will implement the scheme for a while and then we will review the progress. If the risk is imminent, then perhaps the police will have to be called. How about my other 2 questions regarding blueprint? Madam Chair, regarding a carer database. At this moment, we will be focusing on carers of elderly people and of persons with disabilities. We will further consider the consolidation of data in the future. Currently, we have data of service users, but who are the carers? We will have to look into that further. Under Secretary, I hope that in the future, during planning of services provided for carers, please do not forget carers, child carers, or carers of people who have recovered from mental illnesses. Thank you. Next, Dr. Teck Chi-yuen. Thank you. Just then, the Undersecretary talked about the allocation of different resources. Of course, we understand that resources are limited. Carers are a disadvantaged group. We hope that you can accord priority to them. Also, I would like to see better utilization of the Community Care Fund. You can implement experimental projects, let's say for 2 to 3 years. Some deputations have talked about childcare allowances. Can we think about implementing a pilot scheme there? The Community Care Fund does provide lots of resources. Other than allocation of resources, today many representatives talked about the arrangement of services provided. Many representatives said that these parents or carers have to go to different organizations to receive different services. We are not talking about a lot of resources when it comes to the consolidation of such services, but that can be very helpful for carers. And I would also like to talk about carer-friendly working arrangements. This can help carers to have some breathing space when it comes to striking a balance between work and carer duty. I hope that from the suggestions heard today, the administration can come up with appropriate policies. Thank you. I don't need a reply. Well, Madam Chair, I would like to add that regarding the Community Care Fund, we have been looking into utilizing the CCF in after-school childcare services. Just then, deputations have talked about insufficient childcare services. We would like to gradually expand after-school childcare services to relieve parents' burden. And we will also be implementing the community living room project, especially in districts with lots of subdivided units. Thank you. Lastly, Mr. Bill Tang, 2 questions, or rather suggestions. Well, many present here today are social workers. Some of them represent different organizations, and some of them represent service users. There is no systematic training for social workers when it comes to providing support for carers. Is it possible for you to liaise with tertiary institutions, since Hong Kong has an aging population? Is it possible to provide training on these aspects? And today, many representatives have talked about how essential it is to have respite services available to relieve the pressure. There is no regular resource allocation here to train home respite services. Well, there are community care services available, but they are not home care. I can see that similar projects were sponsored by the Hong Kong Jockey Club and other organizations. I wonder if resources can be allocated to regularize such services. Under Secretary, Madam Chair, regarding training on providing support to carers, I understand that similar courses are available in different tertiary institutions. I may have to look into the details after the meeting. I understand that there are respite services available or provided by different organizations, including the Hong Kong Jockey Club. By the end of this year, a new scheme will be rolled out by the Hong Kong Jockey Club. We will continue to work with the Jockey Club and other NGOs to review their work progress and their effectiveness. Thank you. I thank the representatives again for attending the meeting. Our last agenda item, any other business? All suggestions will be compiled into a list, and in July we will discuss this list with the Labour and Welfare Bureau and decide on the follow-up actions. Our next meeting will be held in July to discuss carer-centric policies. Members, please note the date of the coming meeting. Just a moment, please. Ms. Yun, perhaps I'll give you 3 minutes to respond. Thank you, Madam Chair. I would like to respond to what the Undersecretary said. We have been talking about carer-centric policies. Can you point me in the right direction in looking up these papers? What is the current policy direction or goals? Where can we find the policy papers? I believe that they do have an impact on what we have been discussing, especially on the definition of carers. There were lots of questions to be followed up on. So I hope that the Undersecretary can consider the suggestion of establishing a commission for or on persons with disabilities. Currently, there is a mismatch of services provided. Recently, there was a case in Happy Valley. A carer passed away because of lack of medical attention, and in the end, the care recipient themselves nearly passed away as well. So how are we going to, or how are you going to handle such cases in the future? Currently, there are no 24-hour emergency services available. So if there is an emergency, no help can be found. We are happy to hear that there will be a 24-hour hotline, but currently there is no such services. Well, there is a nanny buddy program organized by our organization. They help take care of the elderly in our neighborhood. This cannot solve the problem completely, but to a certain extent, this provides certain flexibility in elderly care. We have made suggestions to the LWB that similar projects can be implemented to 18 districts across the territories. Any response from the Undersecretary? No. Thank you, Ms. Yun. I think that the administration has heard what you said. Again, I would like to thank all the representatives for coming here today. Thank you. Meeting adjourned.